So my name is Natalie, and I'm going to be doing the skill providing mouth care for my patient. So the first thing I do is wash my hands for 20 seconds, and then I gather my supplies. Then I knock on the patient. After I knock, I'd come in if it is okay with the patient, and then I'd tell them the procedure I'm doing today. I'm going to be I'm going to be doing dental care for you today. So mouth care, I'm doing mouth care. Okay, that's fine. Okay, I check their wrist ID band. Okay, after I check that, and make sure it's her. So the first thing I do after I get my supplies, put on my barrier. After I put my barrier on, I do opening procedures. I close the curtain, pull up the bed to a comfortable position, and I check the brakes, put her in father's position, and I lower the rail. Okay. So then I would have my mouthwash, my toothpaste, my toothbrush, everything I'm gonna need to wash the mouth. Okay. So I put toothpaste. First thing I do is put a cover here, a towel, so you don't get wet, and then I put toothpaste on your toothbrush. I start by asking them to open their mouth. I brush their teeth all around, in the bottom, and then like this for like 2-3 minutes, and then I make sure to get every angle. Okay, and then lastly I'd ask to brush their tongue. So I'd ask them to open their mouth, stick out their tongue, and I'd stroke it. Okay, then I'd give them a cup of water. Okay, and I'd ask them to rinse, and then so they rinse their mouth. Okay, and then I'd give them this green fluid. I think it's green. So it's mouthwash, so they could rinse their mouth as well. Okay, after they rinse, you pet dry their mouth, and then tell them that you're done, and if they need anything else. If they don't, you give them their call light, put everything back. So put up the bed rail, do closing procedures, open the curtain again, and then put down the bed, and then check for the brakes. But when I do mouth care, I forgot to add that I do wear gloves. So then before I do any of the closing procedures or touch anything else, I do remove my gloves. Okay, and then but before I remove my gloves, I do gather my supplies, put them aside, and then I grab the towel on their chest as well, and then put it away. And then I take off my gloves, and then I put up the side rail, and I do closing procedures. And then I put their call light with them if they don't need anything else. Then I go to rinse my supplies and tap dry them, and then I put it back next to their bed stand. Okay. And then I'd record and report. I'd wash my hands. I don't know if I said that. I'd wash my hands and then record and report.